The break. Welcome back to the show. You're on Good Morning Sri Lanka, where this morning on a Wednesday we've been speaking about rheumatism and how you can really manage your lifestyle so that if you are suffering from rheumatism you can live a better life, or how you can prevent rheumatism from ever occurring in your life. So there are so many things that we learned today, but I think the most important thing that I got from what our doctors have been telling us today is that there is really no need to worry about advanced state of arthritis happening in your life. There are so many treatments in place and there are so many specialists in place to really help you live a better life, even if you do suffer from something like rheumatism. So that's, I'm sure, very great news for everyone to hear, doctor. But going to something very common, let's speak about back pains and neck pains. Now, if you can just tell us how this can occur. Commonly, what are the common causes of back and neck pains?
The commonest cause for back and neck pain is poor posture. The way you keep your spine position. Because we know the neck and the back consist about 20 bones, starting from up from your skull, going down to your pelvis area. And in between these bones you have cartilage, which is very soft. And around this there are a lot of muscles and ligaments to stabilize the structure. It's just like the knee joint. And when you sit in a wrong way, you stretch these ligaments and you put pressure on this cartilage, and then you start getting pains. And if you don't heed the warning, pain is the first warning that there's something wrong, this will progress to a state where that cartilage will get herniated disc, or we call slip disc, coming. And then you start getting pain shooting down your arm into your hand, or leg pain going down your leg, which we call sciatica. So the wrong posture is one of the things. So the posture has to be corrected. The way you sit at your computer, if you mention the correct posture, it's to keep your ears, shoulders and hips in one line and to sit straight. And if it's a computer monitor, keep it at your eyebrow level.
I see.
And the other important aspect is that you maintain body weight, as you mentioned earlier, and to strengthen the muscles around your neck and your back. Swimming, as you mentioned, I think is a very good exercise. But also things like walking, these exercises also help.
So if I could just ask you, I've also heard that it's important to take breaks when you're working, and so what's the time period you should keep in between each break? Because sometimes people just sit in front of the computer for 5 or 6 hours straight, and I'm sure that's not good for you at all. So what's the time interval that you should take a break?
It's every 10 minutes at least to stand up.
Oh, I see.
Stand up and sit down. And after about an hour to take a good 10-minute break to walk around and just to change. Because what the break does is, if you keep anything in the same position for a long time, it tends to stretch. Even if you stay in the correct position for a long time, it will stretch everything. But once you just change your position a bit, it will relax all the muscles and the ligaments. So I think it's a very important question that you asked, and it's very important to take very frequent breaks from whatever you do.
Every 10 minutes then, so now you have the exact time that you need to take a break. But I don't think many people do that actually.
Actually, it's not taking a big break. After 10 minutes, just stand up and sit down. But after 1 hour, take a 10-minute break, just walk around. I think everybody should be able to do that.
Yes, of course. And Dr. Arisinghe, if you talk about the posture when sleeping, what's the correct posture that people should maintain, especially if they have back pains and neck pains?
Yeah, actually the young who have no problems, it doesn't matter which way you sleep. But as you start getting problems, I think to rest your neck, it's best that you use a very small pillow, a flat pillow, and sleep on your back at least till the pain goes off. And if it's still there, I think you may have to wear a collar for a short time. And that you wear only during the day but not in the night. And if you have shoulder pains, I think best thing is not to sleep on that side.
Yes. And even so many people have back pains and neck pains, they think something is wrong, I have a deficiency in my bones, or I have not enough vitamins in my body, so they start taking a lot of nutritional supplements, doctor. So if Dr. Palangala could just tell us, does it actually work? Does taking multivitamins and calcium tablets really help you with arthritis?
Yeah, that may be there's a placebo effect. Some people they are used to take it and then they feel better and they continue to take it, spending a lot of money on that, but without any valid proven benefit. But nutritional supplements doesn't give any benefit to these aches and pains. But if you are deficient something like vitamin D deficiency or calcium deficiency, especially in old age, due to lack of exposure to sun and poor nutrition, then there's a place for these calcium, vitamin D and multivitamins. But otherwise, these arthritis and neck pain, backache, for those things, the nutritional supplements doesn't give any benefit.
Wow, okay, so that's good information for everyone to know, I'm sure. But speaking about the placebo effect, now this is when, even though there is no physiological change that occurs in your body, your brain feels very happy because you think that you're feeling better after you take the drugs.
Yes.
So is it, if you expand that theory, is it very important to stay positive during a disease of this nature, especially where pain is involved?
I think positive thinking is important anyway,
Generally, okay.
generally, especially with diseases, because the perception of pain is felt in the brain, and if you are very anxious, and that you will perceive the pain more. And we call this, what happens, people start with acute pain, and when it lasts for a long time, it becomes a chronic pain. And chronic pains, there's a huge component coming from the brain, where the brain perceives pain at lesser intensities than a normal person. And then this person ends up being anxious, it leads to depression, and then what happens is people start doing less. They start doing less exercise, and then the muscles become weak. And then the joint pains increase. And with backs and necks, we see these chronic pain syndromes.
I see.
And it becomes very difficult to treat. So it's very important that you have to keep thinking, I will get better, and keep going. And it usually works very well.
I see, because otherwise it will just snowball into more.
It's a
like a
vicious
vicious cycle.
It's a vicious cycle.
Yeah.
All right, so it's very important to stay positive. Whatever disease you have, there is always a cure, right?
There's always a cure, and it's bad as you let it be, so you can make it.
All right,
And
so
people should realize that when you perceive pain, not in the joint but in your brain.
Right. That's very, very true. All right, so if we go on to a specific type of a situation that ladies undergo, pregnancy.
Yes.
And what's the connection between pregnancy and rheumatoid disorders?
In pregnancy, I think one thing that is common again is back pain, because with the increasing weight and the weak stomach muscles, you get a lot of back pains. And that can be easily managed by maintaining activity, being active, doing your walks and all, and also maintaining the weight without putting on excess weight during pregnancy. So that part is very important, and again, postures are very important.
Right. But Dr. Arya Singha, if someone does already have rheumatism, should there be any concerns about getting pregnant?
I think this actually is important in case of rheumatoid arthritis, and also in another disease called SLE,
Systemic lupus
erythematosus, which is really a systemic disease. That's why it starts with a systemic lupus erythematosus. So in rheumatoid arthritis, if they are planning to get pregnant, I think they should first talk to the doctor.
I see.
Because there are certain drugs which should not be taken during pregnancy. But if they still have, there are a few drugs which they can take without harming the pregnancy. And also, I think you should tell the young couples that if you get pregnant, there is a lot of hormones which are produced in the body, and which helps the arthritis. So by the time they are about, say, 4 to 5 months pregnant, almost all their pain disappears. So they can have a very good last or the second and the third trimester.
I see.
And then, of course, you must always warn also that after about, say, another 2 months after pregnancy, that arthritis may reappear.
I see. So it's not. You get a little bit of a break during pregnancy, is
That's
it?
right, yes.
So that's a very good
But I think
incentive.
it's very important to realize that you have to control whatever SLE or rheumatoid arthritis very well before you become pregnant, because otherwise it will worsen during pregnancy if it's not controlled.
And I'm sure that even when you give birth, that's where a lot of the bones going into work come into play. So how can you relieve the pain that you feel during that time? Especially, I'm sure, because it will increase if you have a rheumatoid condition.
Usually we give simple analgesics like paracetamol to control the pain.
I see.
But if they have arthritis like rheumatoid arthritis or SLE, there are safe drugs which we can give during pregnancy also. Even the disease modifying drugs are there to give without any harmful effect to the fetus and the mother. So we can control the disease very well with during pregnancy also, but it has to be managed by experienced physician, experienced rheumatologist.
And at the end of the day, that's the most important thing, isn't it? To go to a consultant, to go to a specialist who knows what they're talking about, and to get the correct advice. Because if you go down the wrong path, I'm guessing that it's very hard to then get back onto the right track.
Yes, because once you get damage, whether it's a knee, whether it's a cartilage, or some disease like SLE can damage kidneys. Once you get damage, it's very difficult to bring it back because there are no drugs. But if you manage it properly, and some of the diseases need a multidisciplinary approach. You need a rheumatologist, you need a physician, you need a cardiologist, you need a gynecologist. So it's managed in a team, most of our diseases, and you need the team approach to cure and manage most of these diseases.
I see. So a lot of specialists coming in to make your life better, isn't it?
Yes.
Of course. But if you take certain types of surgeries, what are the instances when you say, okay, you have to go for a surgery at this point, there's nothing else we can do in case of other types of interventions? What type of surgery do you carry out, doctor?
Actually, when there are changes in your, say, hands, there are plastic surgeons, hand surgeons who can correct those deformities. And in the knees, sometimes you can correct if there is a deformity. But if the joint is worn out a lot, then joint replacement is the answer.
So there are joint replacement surgeries?
It's mostly done for knees and hips, but now I think they are available even for shoulders and elbows. And
I think to elaborate, the knee osteoarthritis, one of the commonest diseases, but the knee replacement is the patient's decision. We as doctors don't say you need to get your knee replaced. But what we try is, we try weight loss, we try strengthening, simple painkiller, but you can't do the strong ones. And if the patient is comfortable and can manage with that knee, we generally discourage surgery in that situation. But if the patient says, I feel miserable after doing all that, then the patient can make a decision on surgery. It's not a bypass surgery, it's not an emergency one that you have to do, but then the patient can make the decision.
So it's up to you whether the choice you make is up to you.
But you have to try all the other measures before you go.
And we also try to postpone it as much as possible. But once they can't manage their own things or do their job, I think then we should consider surgery.
That's the point where you go for the surgery. Alright, so I think we've come to the end of our discussion. Time is a factor that is barring us, I'm afraid. But thank you so much, Dr. Vijay Singha, Dr. Palangala and Dr. Arya Singha, for being with us today and for sharing your expertise with everyone, and I hope you had a good time on the show as well.
Thank you. Yes, we did.
Thank you so much for being with us today. Alright, so that brings us to the end of our show. I have to remind you about Facebook, www.facebook.com/goodmorningsrilanka, and also you can email to us and give us your comments at mtvsports@maharaja.lk. So it's been a great morning, a great Wednesday morning that I've spent with you. I hope you've learned a lot. I've learned a lot as well, and I'll see you tomorrow on another great show on Good Morning Sri Lanka. Have a nice day.